Hi, this is series number 6, and today of the Healthy Root series. And today we're going to talk about sleep and its impact on healing. And we have our guests here, Dr. Crystal, myself, Mark, and I'll let you go, Crystal. Crystal, can you hear us?
Yes, sorry, I bumped myself off.
Okay.
Um, all right, so yes, welcome everyone for week. We are recording you now, right?
Yes, we are recording. This
Oh,
is the sixth series.
awesome. Yeah, so we are on week 6. We are going to be talking about how sleep can impact healing. This is so very important for anybody who is dealing with arthritis, joint pain, any real condition. I see this oftentimes in my own private practice. And so that saying about sleep is the golden chain that ties the body and health together. It really does. I mean, anyone can, if they haven't had a night of full sleep or broken sleep, you know how you feel the next morning. And you know how it can definitely paint the way how you go through your day. So it's really important that when you're getting care at Arthritis VIP, that we make sure that your sleep is in the best optimized position that it can be to really increase your likelihood of getting the best results possible. So, with regards to sleep and healing, we know that consistent restful sleep cycles allows for healing and recovery. And what's really interesting is right now, a lot of people tend to have like either the Whoop bands or the eye watches, and they typically, and like even Fitbits as well, and you can wear them to bed and they can basically track your sleep cycles. And it will also sometimes give you information depending on the app and how you use it, the relationship between your resting heart rate and your heart rate variability. And people will notice that when they get consistent sleep patterns and deep sleep, that their heart rate variability number goes up. And that's something that you want to happen. It's an indication of how metabolically flexible you are with things. So it's really important that you look at the quality and the quantity of sleep that you're getting because this can really impact your body's ability to repair, grow tissue, bone, and muscle. Now, we know that with poor sleeping habits or just poor sleep in general, you can have fatigue and it definitely can affect your rate of recovery. We know that disturbed sleep can actually lower your physical and cognitive function, definitely can have a negative impact on your mood. And it can, for a lot of people, actually amplify your symptoms. So, for example, I hear it often in my own private practice that if somebody has insomnia, whether it's difficulty falling asleep or difficulty staying asleep, and they also have arthritis as one of their chief concerns, they will oftentimes report that if their sleep you know, goes poorly, that their joint pain, they feel stiffer, they feel more inflamed the next day. So it's really important that we take care of the sleeping aspect here with everyone here. So I just want to quickly review the stages of sleep. So Mark, if you can just advance to, yeah, the stages of sleep would be awesome. Sweet. So typically there are 4 stages. Some people will say that there are 5 stages, but to keep things simple, we'll go through the 4 stages. So essentially, the first stage is your shortest phase, and this is where it's quite light sleep. So this is where sometimes you might notice your legs are a bit jerky, and you're just about to drift off into stage 2. And this stage only lasts anywhere from 1 to 5 minutes. So if somebody were to come and wake you up at this point, you would wake up feeling fairly alert. Now, in stage 2, this is a lighter sleep and your body starts to relax. So there's less twitching of the muscles. And if it's possible, and obviously you can't time this, but it is best to sort of wake up during this stage. So usually we tell patients, if you're going to take a nap in the middle of the day, keep it under an hour to make sure it basically sort of guarantees that you're going to wake up roughly around the stage 2 phase of things. In stage 3, this is the deep sleep. So this is where your brain, your body tend to recover. And if you wake up in this stage, you can wake up fairly groggy. But these last 2 stages are quite really important for that healing that your body is going through. And then finally, in stage 4, this is the REM sleep. So this is where you're typically going to get your vivid dreams. And again, if you're woken up during this stage, you can feel pretty groggy and just feeling unwell or unrested. Now, we know that especially with the Fitbit, I know they do a very good job of measuring the deep sleep and the light sleep. So we typically will go through these stages 4 rounds every sleep cycle. So on the next slide, again, as we talked about before, the most health benefits typically occur in those last 2 stages, so stage 3 and stage 4. And so in order to get 4 rounds of deep sleep, so that's where that deep healing is coming about, you need to actually get anywhere from 7 to 8 hours of sleep per night. Now, I practice a lot of Chinese medicine, and there is a saying that for every hour you get before midnight, it counts as 2 hours in total. And so we really like to talk about how to get the good optimized sleep. So a few ways that you can do this naturally without having to need any supplements or any other medications. These are sort of the basic foundational aspects that you need to do to really optimize your sleep. So number 1, lower your noise levels. So if that means you have to wear earplugs or use a white noise machine, do what you need to do to definitely lower those noise levels. I know personally, we live, there's a big industrial park that's about 1 kilometer away from us, but sometimes it can get quite noisy. And I remember back in, I think it was February, their fans just were so loud all throughout the night. And for a solid month, I could not get optimized sleep because I just could hear the constant humming. And I know for a fact when I checked my heart rate variability on my iWatch, like it had plummeted down to 42 when it was typically around the 60s. And I definitely know I was moodier that month. So, the surrounding noise does make a difference. And another big one here is lowering the light levels. This is really important if you live in a city where there's a lot of street lights present. Invest in some blackout curtains. IKEA sells a lot of them at a really low cost. And if blackout curtains aren't an option, definitely wear one of the eye masks. You'll look like a celebrity going to bed, but it can definitely help to block out the light. The general rule of thumb is when you're sleeping. So if you're in your bed and it's 2 a.m., if you can stick your hand in front of your face and see it very clearly, it's an indication that the room itself is too bright. So again, consider the blackout curtains and the eye mask. Another thing to be mindful of is minimizing your screen time. So your screens, either TV, phone, laptop, has blue light that gets emitted, and it's this type of light tricks your brain into believing it's daytime. And so if you, for whatever reason, can't minimize your screen time, invest in a pair of blue light blocking glasses, and that can definitely help to minimize some of that blue light that you're getting. And the type of glasses that you're looking for that will block out the blue light glasses in the evening time, they will have like an orange or a yellow lens to it. So it's not the coolest looking pair of glasses, but it can help to some of my trickier cases with insomnia. It has been quite helpful. And the big thing is consistency. This whole thought pattern that Monday to Friday, you can go to bed at one time, but then on the weekend, you can stay up till 2 a.m. It just doesn't work out for somebody who has difficulties with sleep. So, ideally, we like patients to be in bed before 11 and then, getting the 7 to 8 hours and waking up between 7 and 8 a.m. the next day. But consistency is super key. And again, going back to that Chinese medicine saying, and I don't know who said it, but every hour of sleep before midnight is worth 2 hours after midnight. So for example, if you typically go to bed from 12 to 7 and you shift that time closer to 11, So 12 to 7 is 7 hours. In Chinese medicine, if you go to bed between 11 to 7, your body registers that, or sorry, 11 to 6, your body will register that instead of 7 hours, it's actually 8 hours. So people typically feel far more rested if they're in bed before midnight. So ideally, 30 to 60 minutes before bed, doing an activity such as reading, doing a puzzle, doing something that just doesn't involve you being on a screen is helpful. Definitely having a warm bath or a hot shower can also be helpful. If you practice alternating hot and cold showers, I find for some patients it works really well. For other patients, it's almost too energizing for them. But if you do have any muscle or joint discomfort, taking a hot or warm bath with 2 cups of Epsom salts, that can be really helpful to just sort of loosen up the muscles, help you get relaxed, and help you transition into that ideal optimized sleep. Meditation is also a beautiful thing that you can do a few minutes before bed. And if you use this app that I've mentioned here called Insight Timer, it's a free application that you can get online. I use it every day, first thing in the morning, but you can use this before bed. You literally can set it so that you can do a meditation 10 minutes, 5 minutes, 1 minute, half an hour, 60 minutes. They've got so many different options. And this has been proven through science to really help somebody get their brain waves more in line with the deeper quality of sleep and really helping with that transition aspect. So, again, if you're the type of person that finds it very difficult to wind down, this would be a really good option for you to incorporate into your nighttime routine. Now, if you have purchased any of the supplements through Arthritis VIP, there's too many to mention, or there's 3 that we typically recommend for sleep. So we typically will recommend melatonin, magnesium, and then this formula here called Sleep Relax. So melatonin is a hormone that can help initiate sleep. So it's not a very it's not our primary go-to to help people who need to stay asleep, but it's a great option to help fall asleep. We also know that melatonin is an antioxidant, so it's very good as an overall for general health and maintenance. The key thing to remember though with melatonin is that you do need to take it around 8:30 to 9:30 p.m. in order to really maximize the circadian rhythm and making sure that we're mimicking that circadian rhythm. Magnesium is also another thing that we typically recommend. And then this is one of my favorite products that I love for almost all of my patients. It's called Sleep Relax, and it's a blend of different herbs. And what I love about this formula is that it's not habit forming, and neither is melatonin and magnesium. But this specific formula helps to calm that nervous system. And it's really great for people who typically will say, well, I toss and turn throughout the night. And I find that I'm a light sleeper, or I find that my mind is quite active and it's hard to settle in. Ideally, you do want to take this product between 8:30 and 9:30 p.m. So you can take it at the same time as the melatonin and the magnesium to really encourage great quality sleep. And then lastly, everybody is very, very familiar with this slide here. Again, sleep definitely, I mean, I would argue that it can go under the emotional stress and the physical stress, because you know that if you get poor sleep, that in of itself can be quite physically jarring and create an inflammatory body. And we do know that emotional stressors can definitely impact and bring on that poor sleep aspect. So, you really want to tackle sleep from that mental, emotional standpoint, from the lifestyle, from your habits, and then supporting the body where it needs with any supplements.
Awesome. Thank you very much, Crystal, for this. I have a couple of points that I'd like to add. This is the experience that I had personally and with my patients. I would start with the what you mentioned earlier with the sleep cycle of those 4. There is a science around the sleep cycle ranging between 90 minutes to 120 minutes, which is basically an
Yes.
hour and a half to 2. and it's variable. It's not really on the dot. So what I plan myself to set the alarm on a 4 or 5 cycles, so that way I don't wake up in stage 3 or 4. So think about it this way: if I'm gonna if I want 7.5 hours of sleep, means that this is sorry. If I want 7.5, this is 5 cycles. So if I'm gonna sleep at 10 a.m., I gotta wake up at 5 a.m. If I'm gonna sleep at 11, I'm gonna wake up at you add the 7.5 hours. That way you kind of gauge yourself. And the interesting part about it is you got to map it out because every person is different. So if
Yeah.
you set it for certainly for 7.5 hours, which is 5 cycles, and every time you do that, you wake up groggy, then you stretch it for an extra 15 minutes till you figure out what your cycle is, because every person is different, right? This is not
Yeah.
a cookie cutter, and it requires a lot of work from our side. But once you do that, now you know what your sleep cycle, and you know when to set your alarm up and to wake up. The other thing is from a hormonal balance point of view, growth hormone starts to peak at 10 p.m. and starts to go down by 6 a.m. That is when healing repair happens. And that's when building muscle happens. That's when fat loss happens. And if you want to optimize that between 10 p.m. and 6 a.m., so every time, as Crystal said, you sleep toward the midnight, basically you shorten that duration to about 6 hours
Yes.
instead of 8. However, there's a couple of other things that mess up that cycle, even if you went to sleep at 10 p.m. If you eat food right before you sleep, the insulin will go up. The body thinks that you're still in digestive mode, so the growth hormone will go down. So you have to kind of avoid food an hour to 2 before you sleep to leave that room for the growth hormone to peak at 10 p.m. Other thing that will push the growth hormone down is stress. And stress can happen. A lot of it, personally, I feel either from argument with others right before you go to bed or social media and news. You listen to news, 99% of that stuff that you listen to, you really have no control on it. And all you're going to do, you have a spike in that cortisol level, and that you worry all night long for stuff that you can never change. Like there's nothing I can do for environment as a globally, right? There's nothing I can do for an accident or a train that derailed in Mexico or in Brazil. There's nothing I can do. So that bad news is just basically spiked my cortisol level, brought my growth hormone down, and now I'm suffering all night because I did not recover and heal. Regarding the other thing with the, you mentioned that about the screen time, right? So I'd like that to be roughly an hour before you go to bed. You don't watch anything, even if it was nice and funny and comedy, whatever. Just the screen time itself and the blue light that you talked about. There's some functionalities on some of the smartphones where you can put the blue light screen on.
Yes, correct.
On computers for sure, not on TVs that I've seen. So you're
Yeah.
gonna be stuck if you're gonna watch it. You just shift it to the blue light screen on your iPad or any screen other than TV, and then you can get through it. Speaking back to the story of the growth hormone and stress, when I followed everything to the T in terms of exercise and food, when I was doing my emergency room shifts, and it was almost every 2 or 3 nights you do an overnight, and I don't sleep till 3 or 4, sometimes be up all night. Despite the fact that I was doing only 4 shifts a month, that's an overnight, I struggled forever to lose weight and nothing was happening.
Wow.
My inflammation was all over the map. And it's only 4 nights per month. The only time that regulated it is when I shifted to day shifts and everything fell in track. I have less pain. I start losing weight. I did not change my diet. I did not change my my exercise regime. It's exactly what I did while I was doing emerge shifts. The only difference was my sleep cycles or my sleep hygiene. and that made a huge difference. And if you want to do a short stint of it, imagine when you travel and there's that jet lag,
Yeah.
you feel groggy, you feel awful. And if you don't sleep well, that's what you're feeling all day long, right? One more other point, which is people that take pain medication, anti-inflammatory to help their pain, to help inflammation, most likely they're going to end up with GI upset. And most of the doctors will prescribe them PPIs like Lozac or any of those medication just to help the stomach. And one of the major side effects for that one is sleep deprivation. So you're taking, so it's kind of a vicious cycle. I take pills to help reduce the pain that I have, but it's going to upset my stomach. Now I got to take medication to help my stomach upset, and in return, I'm going to suffer from sleeping. And
Right.
when you suffer from sleeping, you're going to have more pain because that's when you heal and repair, and the cycle will be go to the doc again. Can you increase the anti-inflammatory, or can you increase my painkiller, or the funniest one is, can you give me a sleeping pill?
Yes,
And
definitely.
like, okay, wait a minute, we can back off. And that's why we go back to what we talked about the first couple of months is if you fix your diet, you reduce inflammation, you don't need anti-inflammatory medication, thus you don't need any stomach pills, thus you don't
Yeah,
need any sleeping pills. So it's all connected together if you think about it, and that's why we go in that sequence for the last couple of months.
absolutely.
Yeah, so those are just extra points that I felt worth mentioning because I suffer from it myself. One more last two bits is caffeine intake past 2 p.m., whether it's tea,
Yes.
coffee, or alcohol, and or even taking a nap past 2 p.m. is gonna mess up your sleep cycle, right? So you feel energized and you don't want to sleep at night, and now it's just because of a vicious cycle.
Yeah.
Personally, I love coffee. Now I restrict it the first thing in the morning around 6:30, and that's it. I just have one and no more caffeine after that. So, and I will resist as much as possible not to take any naps, even if I have the chance to. That way I can sleep by 10 p.m., 10:30 at the most.
Yeah.
Yeah.
Yeah. Yeah, I
So
was just
yeah,
going to comment on that.
what's
Yeah,
that?
that I was going to mention that, like, I think it's great because everybody genetically will have a different way or speed of metabolizing caffeine in their body.
Yes.
So I like the general rule of thumb of, 2 p.m. If you can have that as a cutoff, that's helpful because that's something that I will typically do myself. Now I know I can push it to 5, but that's just been trial and error on my part. So I think as a general rule of thumb, 2 p.m. is a great time.
Yeah. So the take home message is we gave you guidelines here, but you need to study your own body from sleep. Just like we talked about before,
Yes.
you need to study your own body of what to eat, how to eat, the timing, the frequency, the amount, what time of food, vegetables, meat. Everybody's different. And guess what? Not to complicate things, but it will be interesting as you go through those two exercises, the food and sleep, in 6 to 9 months or of a year, things will change in your body, hormone wise, enzyme wise. So you really need to
Yes.
evaluate and be adaptive. You don't
Yeah.
say, this worked for me last year, it's going to continue to work for me forever. We are evolving too. Our gut flora
Yes.
is going to change. You have to adapt to it. And sadly, I see most of, whether patient or non patient, they figure certain diet, certain sleep, and they stick to it for the last 20 years or so. It does not work that way. You have to be
Yeah.
adaptable and you have to correct and continue.
Definitely. It's being flexible. And I think it's also, what I teach patients a lot is like, listen to your body.
Yes.
If your body, if it's working for you at some point, it's not anymore. Your body's telling you it needs something different. So listen to it.
Yep.
Yeah.
Another point is about oversleeping. So they did a study for people that slept 4 hours or less every night consistently. They increased risk for apnea, heart disease. And then they tested those people who slept 10 hours or more per day. They had the same risk. So undersleeping or oversleeping have the same detrimental effect on your health and body. So
Right.
there's a sweet spot that you need to figure out between 6 to 8 or 9 hours. You have to figure out what your body needs the most. And if you're in chronic pain, you might need more hours than someone who's healthier.
Yes.
And yes, so because you need to give it extra time for that healing recovery overnight.
Yeah, definitely. We understand too that living with arthritis wherever in your body, it can make sleeping uncomfortable for some people. So, if it's investing in a proper mattress and a proper pillow, learning about sleep hygiene, like proper ways to be sleeping for the condition that you have, all of that plays a role in exactly what you mentioned that, if you find that like, you can sometimes wake up from pain and feeling uncomfortable, you might need those extra hours of sleep.
Yeah. And if you've seen whoever came to us to the clinic, well, our method is let's deal with the pain first. And that's what we do, whether we do prolotherapy, PRP, let's handle the pain first. And then
Yes.
let's work on the other habits with your food and sleep and stress. And so to optimize the healing, to optimize building more tissue, more collagen, and so forth. So yeah, all of those kind of sounds nice, but if you're still in pain, you're still gonna have struggle to
Yeah,
follow along, right? So
definitely.
our first go-to, let's get rid of your pain in a natural way, and let's move on through that system.
Yeah, that makes sense.
Awesome. Well, thank you, everybody. Thank you, Crystal. Thanks for everyone who's going to be watching this later. And again, if you have any question, you can reach us at Arthritis VIP via email or the text message that we have. And we'll catch up with you in the next 2 weeks. Awesome. Thank you
Amazing.
very much,
Have a great
Crystal.
night.
Have a great evening.
Okay. Take
Bye.
care. Bye.